Hello everyone, I'm Dr. Shabahat Ali. I'm consultant cardiologist, nowadays working as assistant professor of cardiology. So today I'll be discussing another important topic with you guys, another important investigation with you guys, and I'll give you a very brief overview regarding that. What is echocardiography and when to perform it, why we usually advise it, and what we look into that. And another detailed video regarding echocardiography you will be finding in in coming weeks. So I'll be giving in this video a very brief overview because you will be able to understand that in a very simple language. First of all, I would like to request you guys kindly like my channel, kindly subscribe it, kindly click on bell icon, and if you like my video, kindly share it with your family and friends because purpose of making my video is to educate people in simple language in terms of their health related issues. Okay, so what is echocardiography? Echocardiography is a very important parameter, I must say, after ECG, and this is the main base in any cardiac investigation, or any I must say base of your cardiology uh, management, because in simple language we usually call it as ultrasound of your heart, and it's non-invasive investigation. Even in pregnant ladies, they can go with it without any fear of any harm to their child, and it can be done with anyone, and it can be performed on anyone. There is no side effect at all for this investigation, except from if you are allergic to any gel which we usually use for ultrasound or echocardiography, on which we apply on your skin and on our probe. That is the only very minor thing which is very rare, I must say. So what we usually find in echocardiography? In echocardiography, we look about in your heart, and we look at your heart as a complete overview. The most important thing is ejection fraction, or your pumping power, I must say, which we note. Thickness of your walls, especially of left ventricular, any pressure or any segmental wall motion abnormality of any segment of left ventricle is very important. That's what we mainly check in echocardiography, as well as we look for any abnormality in your heart valves, which we any regurgitation, any stenosis. Ideally, there should not be any stenosis, or in simple language, valves are like windows or doors in between your heart chambers. They should not be narrow, or they should not be loose. Why? Because when blood is pumping from one chamber to another chamber, ideally it should not be having any hurdle in movement into another chamber through wall. And if your wall is loose, and your blood will be regurgitation will occur, and it will come in backward direction into that chamber, which has pumped that blood into the front one. So when regurgitation occurs, usually it can lead to increase in that chamber size. So that is very important. So any congenital abnormality, especially in any child, if he or she is having any fainting episode, any fainting episode during his normal schoolwork, or any playing, any dyspnea or anything, we usually look for any congenital abnormality. And moreover, if your child is having any birth related issues, if you are noticing any bluish of lips of your child, or any bluish coloration of your child's face, doctor can prescribe with advise to go with echocardiography. Okay. Another important thing, as I mentioned you before, like especially the ejection fraction, we need to look for either you are especially in those persons, like if they are having any shortness of breath, especially over the time, we need to look for that. Either you are going for with heart failure or not. Another important thing that some many of even doctors usually misses, like diastolic dysfunction. They should mention in their reports as well regarding diastolic dysfunction, because if your ejection fraction is totally fine, your pumping power is fine, but your heart's relaxation thing is having dysfunction, that will call like diastolic dysfunction, or in simple language, heart failure with preserved pumping power or ejection fraction. Okay, so same, like if you are having symptoms, like we need to prescribe you medications, because we need to improve your quality of health, and improve your daily activity as well. So these are very important things. Many times, like in rheumatic patients, again, like as I may have told before, like valves are very important, so we usually look for valves in those patients. And if you are having any chronic infection and or fever of unknown origin, doctor may prescribe advise with echocardiography as well. Okay, so I hope this will be helpful for you guys to understand what is echocardiography. Detailed video you'll be finding in coming weeks. Take care. Bye bye.